our meeting to order. We'll have roll call.
All right, I will go ahead and call the roll. Alderperson Rankin,
Here,
Alderperson Tenorio,
excused.
Dr. Roberts,
Here.
right? Linda Brook.
Here,
Did I say it correctly? You can correct me if I did not.
you can pronounce the E, Grolke.
Brokey. All right, I will remember that for next time.
Yeah.
All right. Allison Lancione. Right. Daisy Jimenez.
She just texted me, she's got a family matter to attend to.
Okay, Jane Edgar,
Here.
This is ours, I think.
Holly Schmidtke. And Barbara Janusiak.
Present.
You wanna defer to me to introduce these folks? I just recognized that I didn't put like a welcome on
Yes,
here.
if you would like to, Bob.
Okay. So for the greater good, I just would like to introduce a couple of our newest members to the team. To the front of the table is Kevin Smith. He is our new environmental team lead. So he will be giving a presentation in a little bit. And then directly in front of me is Melissa Feldmeyer, and she's our new business manager. And so she was very willing and very gracious to take ownership of the logistics of this meeting. And so bear with us as we kind of work through the motions here, at least this one time.
Well, we certainly welcome these two individuals. I'm sure they'll do a fine job and do our department well.
Thank you.
Mhm. Okay, next we have the approval of minutes. Minutes of the September 23rd meeting.
So
Is there a motion?
Yep.
Been moved,
Second.
moved and seconded. Discussion? All those in favor?
Aye. Aye.
Aye.
Opposed? Carried. And there are matters for discussion or action. Environmental health report out.
So yeah, it's
Bob?
your tab. Yep, so that'll actually be Kevin. Kevin will have a little presentation here as we pull up the slide deck. Can I borrow the keyboard, please?
Oh, yes.
You can hang on. to that. He's a master.
All right. Well, hello, everyone. Nice to meet you. So what we're going to do today is go over basically what programs environmental health covers. And I'm going to do a quick and skinny report on what these programs are. Each one of these has a lot of regulations tied to them and policy and all that too, that I'm not going to get into too deep, but I do want to just introduce what these programs are. Okay. First of all, I want to introduce our environmental health staff. We have Ashley Palin, and as you all know her, she's the Director of Community and Environmental Health Services. I'm Kevin, I'm the lead environmentalist, and I'm the new guy. Peter Feldhusen, he's an environmentalist coordinator. He's sort of a general guru. He's an expert in everything that we do, and he's been around the longest. I think he's been here for 10 years. We have Amy Lewis. She's an environmentalist. She's also been around quite a while, almost 5 years now. She's definitely an expert in everything as well. And you may recognize her from the recent rodent presentation that she did. And Lindy Wiedmeyer is our fourth environmentalist, and she's definitely an expert in food safety, and she's also an expert in the other programs that we do too. So There's 4 of us that have boots on the ground, and Ashley is the director, and of course Bob is the health officer. I want to introduce you also to our areas of assignment. Oh, looks like Holly is joining us, or is that right?
Yep.
Okay. Okay. Oh, is she here? Okay. All righty. So on the left there, that's my area in pink. Okay. And the red lines are the aldermanic districts. So if we know a lot of people have contacted the aldermen and have concerns or questions, and so a lot of the times we would request that if those questions come to you, if you're an alderman, that we would have you contact us so we can each address our area. So Peter is down there in blue. He also does Greendale. Lindy is to the north, and she is the yellow area. And Amy is green, and she covers West Milwaukee as well. So if you are an alderman and you have questions, or if you live in our area, please contact us directly if you would like. Otherwise, you can go ahead and contact the health department, and they'll direct that call for you. So I'm just kind of curious who's an alderman here. You are?
Rosalie, aren't you?
Rosalie is, in what district are you in?
5th.
You're in the 5th, so.
I'm in the pink one.
Okay, so you could contact me or Peter, it looks like. There's a little section that would be Peter. Are there any other aldermen in that are present right now?
Yes.
No?
Not present, but older
Tenorio.
scenarios on here.
Alderman Centenario.
Scenario?
So far he's excused.
Okay.
He's
that
in the
would
first
be-
district.
First, yep.
I'm
First
on the
degree.
village board of West Milwaukee, so I qualify under Amy.
Yep.
As a contact.
Perfect. Yes, and if anybody has questions, you can always, this map's intended to help you guys direct those questions to us so that we can help assist in those matters, okay?
Great.
Yes.
This is Jane Edker.
All right, great, thanks. Thank you, Jane. All right, so this we can cruise through here. That's just who the aldermen are for each district and what areas of assignment they would be referring calls to. So, all right, so what we do, we are an agent to several state programs, including DATCAP, which is Department of Agriculture, Trade, Consumer Protection. The big umbrella term there is licensing and inspections. This is going to be our food, retail stores and restaurants, lodging, so hotels, motels, and tourist rooming houses, which are like Airbnbs. Pools and recreation, so this could be, well, your pools at the high schools and hotels. We don't have many recreation facilities. That would be like a rec ed camp. And then weights and measures, so we look at gas pumps and scales in grocery stores are the big ones there. Also for Department of Safety Professional Services, we do licensing and inspections, primarily of tattoo and body art facilities. And we are actually an agent to the state for lead poisoning prevention. And that picture down there on the right is what lead-based paint looks like. This is on a very old and abandoned structure, but it looks like that alligator skin crackling. And so we have a contract with the state to implement lead poisoning prevention. We do home investigations, typically when there's a child who's lead poisoned. Okay. Then we also have our own local licensing programs, and those are determined by our local ordinances. That includes our animal fancier permits. So that's if somebody has more animals than are allowed to be permitted, they need an additional permit there. We're allowed up to 4 dogs and 6 cats total, so that's 10 pets with that animal fancier permit. We do pet shops, kennels, and grooming establishments. We do sanitation licensing, so that would be a bar with no food, But we still want to make sure that they're keeping their facility clean. This is not the liquor license. This is just an additional sanitation license, so we do quick inspections there. And then also physical conditioning facilities. So these would be your typical gyms and fitness facilities. And rooming houses, that one's a little more complicated. I'm still learning that one, but those are going to be where there are multiple people living in close quarters, not individual apartments though.
Or transient.
Or transient. Yeah. Okay. We also handle environmental complaints, and these can be very broad. So they can include anything from rodents to hoarding, people feeding wild animals, noise, and chemicals. And then finally, we also do animal bites, dangerous dogs, and rabies prevention. And so anytime there's an animal bite, the police will follow up on that. And we have to issue quarantine orders for the animal. They have to have vet checks to ensure that they don't have rabies. And then we have to issue a formal release of the animal from quarantine saying that it's healthy. In some cases, we can submit the animal to the state lab for testing. And we would need to have the animal submitted intact and in a timely manner so that we can have that tested for rabies. Okay. And the most recent and up and coming programs that you will start to hear about soon. One of them is going to be some block grant funding for rodent control. And Ashley is going to talk a little bit more about that today.
Yeah, so I can just briefly go over what that is. I'm not going to share too much because it's relatively new, but we did for 2022 receive some funding to assist with the rodent control issues in West Dallas. That's a primary complaint that we tend to get here at the health department and something that's often on, next door. And I know the older persons hear a lot of complaints about rodent issues as well. So to address that, we did receive some community development block grant funding that will allow us to start a task force, a group that can meet of other city staff to figure out how we can address this issue more comprehensively, as well as looking at how we can financially support some pest control assistance for residents in the area that are just not able to bring in a pest control company on their own due to financial constraints. We'll be able to assist with that and hopefully allow us to do more like abatement of rats.
Yep, and to add on to that, I can say it's just about daily we receive a new complaint about somebody who saw a rat anywhere in the city. And so we do get a lot of phone calls every single day, at least about rats. Somebody saw a rat or they think that there's a nest in their neighborhood. So it's pretty surprising how many calls we do actually get about rats. And so this program is definitely a great step in the right direction.
What type of control do we think?
So currently our control is largely education focused. So ensuring that people understand what causes rats to live within a neighborhood, which is generally access to a food source and then an area to shelter. So it could be people who have a lot of furniture or other things left in their yard or sites in which they can just live in. And then often people who are feeding birds and using like bird feeders and they're improperly allowing that bird seed to fall all over the ground and become a hazard or something that the rats can eat, or just other people who are feeding the rats or other animals within the yard, feeding squirrels, throwing out food on the yard will cause a rat issue. So we're ensuring people know what those causes are so they can stop doing them, which will often be the primary kind of form of prevention, is just taking away the things that rats are eating, as well as the areas in which they're living. But for some more serious cases where we've had like rats really burrow and move into a property, sometimes it's helpful to bring in a pest control company that can help with eliminating the population of rats there as well. So we can trap them, you can poison them. It's just helpful to do that with a company, so it's a little bit more controlled than someone doing it and potentially risking children or dogs or other animals getting poisoned.
So again, just to kind of reiterate, the idea with the CDBG funds is really to begin at a city level, to look at the rodent rat issue from a more comprehensive perspective. So health department, bins, there could be some other folks who are going to be part of that conversation. So yeah, it's just kind of looking holistically at what we can do from a prevention perspective, but as well as control perspective, to include everything that Ashley talked about, food sources, to the point of also looking at any kind of structural issues, within a building, where there are cracks, where rodents and rats in particular can live. And then as well too, I know you've been part of some discussion around the refuse containers. And so that'll probably come up in the context of this larger task force or work group, that's going to look at the broad issue of rodent activity in the city. Yeah. So it's going to take a little while, to kind of get to that point where we're going to see any diminished returns as far as, the rat activity, rodent activity, but we got to start somewhere. And it's got to be a more comprehensive approach. It's not just about what the health department can and can't do.
From what I understand, we don't distribute any poison though.
No.
Yeah, we've been advised not to because of the liability that could come with an accidental poisoning of a non-rat, even a person.
But there is some intention though, with the start of the CDBG project to bring in pest control companies to talk about from their perspective best practice, and that could involve some amount or some form of baiting, and but that's the control side of things. It's not necessarily going to take away the problem long term. It's kind of the reality, and but anytime we would bring in any kind of baiting, that's in a very controlled kind of situation.
Yeah, that'd be somebody that we hired.
Yeah.
to do that.
Well, from what I understand, it's all over with Dallas. I mean,
It's popping up.
we were just made known of a problem in my district
Oh,
that has surfaced, so
Yeah.
I'm sure that.
So then with the CDBG funds too, just because of the nature of those funds, they have to be used in a very specific way, targeted to very specific sectors of the population. And so that's an area that we need to work with our friends on the development side to get a better line of sight in terms of how we can actually apply, implement those funds.
Well, I'm glad that we finally got some help from them.
It's been a good partnership. Yeah.
Right.
So they've been very, it's been a mutual conversation.
Right.
Do we have any identified hotspots in the city?
There are a couple which I won't share because I don't know the crossroads off the top of my head, but I've been working with our environmentalists to try to figure out some areas that have heightened activity. It does shift over the course of time. Some neighborhoods will really work on doing some cleanup and therefore they lessen their rat population within their community. But there are about 2 or 3 different areas throughout West Dallas that do have like an increased level of activity.
Okay.
That we're aware of.
does anybody else have any other questions? There's always a lot to talk about with rodent control. So it's going to be an ongoing discussion, but it's definitely, like we said, a step in the right direction with the pure volume of concerns and phone calls that we get. So we're hoping to put a dent in that coming up in the next year or so. Okay. Also, has anybody heard about OpenGov?
Open what?
OpenGov, like government, OpenGov.
Oh,
It's going to be an online application system where they handle parking permits, building permits, and for us, it will be those animal fancier licenses for now. And so with that change, there's going to come some adjustment periods for people who hold those licenses. And so we'll be working with people over the next year to accommodate the change from a paper application to an online system. And like I said, that's for our animal fancier permits. So we'll be having that for the dogs and the cats, and they can submit that application online with payment as well. So those are really the two big and recent changes that we're dealing with, and so I'm sure you guys will start to hear more about that as that's rolled out.
Okay.
So, all right, I just want to say thank you all for your time. I think we kind of rushed through that, so if there's anything you guys want me to go back to and go over again, let me know. And I think, is this presentation be available for you guys if you need it for reference, if anybody has questions about any one of those environmental health programs?
Okay.
Any committee member have a question? Oh, Kevin?
Michael, I have a question. When people call in with a problem, do they get then slotted to the correct person that handles that area?
Ultimately, they should. Sometimes there is a little crosstalk where we will provide backup to somebody if they're kind of in the middle of another situation. We will sometimes help each other out, but on the whole, those are our districts, and those phone calls do make it to the person who's in charge of that district. Yes.
Okay.
Can I add to that quick? So something I forgot to have Kevin include in our slides is that we do have an environmentalist of the day phone program. So oftentimes the environmentalist staff are out in the field. They're not in the building because they're doing all of these inspections and on site at different properties or businesses. So, you know, it can be frustrating to people to constantly need to call and leave a message because they're not able to get a hold of someone since the staff is out in the field. So we have implemented a phone time period in which we make sure to have an environmental staff person in the building every day from 8 to 9 a.m. and then from 3 to 5 p.m. So there's a person on site who can talk to you if you have questions, and you don't have to sit there and play kind of phone tag back and forth. So if you do have people that you're talking to that want to issue a complaint or just have a general question about, you know, starting a business, something like that, and they're, you know, wanting to be able to speak with someone live at that moment, I really do recommend that people would call between those hours of 8 to 9 and 3 to 5. That's your best chance of getting someone on the phone. It might not be the person in your designated area because it's not all 4 of them, it's just one of them, but they're very well cross-trained and can answer just general questions and start that process for you.
Is that information published somewhere?
It's on our website as well as on our social media. It's relatively new. The nurse has had a phone line for years, the nursing department has, but environmental, we probably have started that within the last 6 months. So we have done a couple social media postings and put it on the website for people to be aware of. And we, you know, we notify people too if they're calling and they're frustrated that they keep getting a voicemail. We do kind of share that those are the better times of the day to call.
So will this be going in a newsletter that goes out periodically?
I don't think it went in the last newsletter, but it could be something we share in future.
Okay.
I don't think, are we posting the district map? I don't believe we're posting that.
The district map is on the website
It
as
is.
well. Yep.
Okay, so that map is also on the website. I don't think it has our names on it, but it does say which district, and we'll know whose that is.
So actually, the district map's on the website, including the name and direct phone line for each environmentalist. So you can go to the website to figure out how to directly call Kevin if you want to bypass the front desk. I mean, our front office staff is great and can get you there too, but I know sometimes it's just, you know, you don't want to go through the rigmarole of going from, you know, a phone transfer. So those numbers are on our website as well as the areas that they cover.
There we go. So they have it. That district map is there with their names and phone numbers.
Well,
And it's recognized too that the website, certain things on the website need to be elevated a little bit. And so this is probably one of those that we need to give a little bit more attention to and put it closer to a front page rather than bury it. I know things can get a little buried.
Well, the reason I even raised that, because not everyone has computer access or is computer literate. And so if there is not some piece of paper that they can read that in, it's not going to get, the information is not going to get there.
Good point.
Yeah.
So remember, if you want to talk to an environmentalist, it's from 8 to 9 and 3 to 5 every day.
Yeah, and you can call during the middle of the day and someone may be here, it's just you're kind of more guaranteed during those times.
Okay.
Oh, whatever.
Any more questions? You
No,
did a fine, both of you. Thank you.
Thank you too.
All right, and no more questions, then we'll go on to number 3, communicable diseases, the COVID-19 update.
Yeah, so I'll have Melissa share our most recent COVID summary report. Is it
Oh,
down on
maybe
the
it got
bottom?
closed. If you go to the,
No, it's
it's there. The third one in.
Put the boxes in the colors.
You go back to where you were.
but you can't. click
Yeah,
on
it's not gonna let me.
Okay, so if you go back to the 20,
Oh, I think I have to do it this way.
there you go, right there.
This one.
So are you guys seeing that
No,
report?
they're not.
Oh, yeah, okay.
I'm not seeing a report. This is Grelke.
No,
I'm not either.
We're working on it. There we go.
I think we're. Okay, now you should be able to see it if you can see it. West Dallas multi-COVID weekly summary.
There
Yeah.
we go. Yep.
Perfect. So I talked about this many times in past in these meetings. And for this meeting, I just, was last month, I was doing a more comprehensive overview of quarterly, maybe a tiny bit better. Even, I have pretty good eyes, but it's a little small for me too. Last month was the quarterly communicable disease report. So this time I just really wanted to, just focus on COVID. We'll do another quarterly general communicable disease report near the end of the year. So for COVID, I often talk about this report and say that this goes out on Wednesdays on social media, the city website, the emailed out newsletters that the city has that you can sign up for COVID. It goes out to all city employees. And it's just really what we use to share most recent COVID data as best as we can on a weekly basis to get numbers out. So instead of just having the numbers available to you as I normally do, this week I wanted to just actually pull that report up so you can kind of see what yesterday's report was. So this is the one that our public health specialist developed yesterday. It does include all of our weekly numbers, which is what I go over generally here too, which says that, in the last week, we've had 96 new cases of COVID. That number has gone down. We are kind of on the back end of an increase. So we're starting to see our numbers decrease, which has been great. I won't lie, I know staff is really appreciating the reprieve of COVID case follow-up, especially as they gear up to do more vaccinations. So we did have a little bit of a decrease and continue to. If we look at our testing numbers there, so how this is laid out is that those blue boxes at the top, those are the state numbers of positive and negative COVID test results. The orange is West Dallas with Milwaukee. So we're just at 9,712 positive cases so far since the beginning of this pandemic, so since March of 2020. And then we had about 37,000 people that have been tested for COVID. Those are individual people, not test results, but people who've gone for testing that had tested negative. The death number for West Dallas West Milwaukee is 149. And I know we've talked about probable cases before. That number is 970. Those are people who go and get like a quick rapid test done where it's saying highly probable that you have COVID, but it's not, that test does not have the efficacy for the state or CDC to deem it as an actual confirmed case. However, we treat it like a confirmed case. People still stay home, they isolate, we do contact tracing. So on the top of the report, those numbers are always shown on this weekly summary. It's a great thing to look at if you're kind of wanting to get a quick snapshot of what's going on with COVID in West Dallas and West Milwaukee. And then down below, I'm going to just scroll a little bit. Melissa Francis, our public health specialist, always does just kind of a feature on the hot topics around COVID for each week. So this week, I'm sure you guys are all aware, there's been a lot of changes for COVID vaccination, so that's what she focused on. The biggest change being that with Pfizer, for the last month, 2 months, you've been able to get a booster dose of that, a third dose of the Pfizer vaccine for people who received Pfizer. They've now expanded that eligibility for COVID boosters for people who've received Moderna as well as the Johnson vaccine. So those individuals who've received Moderna or Johnson & Johnson can now get a booster dose. So for people that have received Moderna, after 6 months of having their second dose, they can get another vaccine. And those that have received Johnson & Johnson, they can get a second dose at 2 months. They've also changed the eligibility to say that they do not need to receive the same vaccine they received previously. So if you've gotten Moderna before, you can get J&J, you can get Pfizer, or you can get Moderna. They're letting you interchange those vaccines, which is a large change that has come out. Previously, they said, we could, but they really didn't recommend it, and now it is an allowable thing to do. So we continue to offer the Pfizer vaccine here in West Allis through our clinic. We are opening up booster clinics throughout November for people to receive their own booster vaccine, and we are going to be vaccinating those that have received Moderna and Johnson & Johnson as well with that Pfizer vaccine if they're wanting that. So we have some of those set up. There's a link on our website. People can call our main number if they don't want to sign up online, and our staff will assist them in signing up for an appointment. That's also going out in a bunch of different avenues, doing some targeted outreach for people who we've vaccinated in the past as well. That's the largest change that's been implemented. The thing that's kind of on the horizon now, this next step, is that the Pfizer vaccine has not been officially approved through the Wisconsin DHS for 5 to 11s, but that is on the horizon and something we're expecting to come through next week. And we are already therefore looking to do some clinics for vaccination of children 5 to 11 with the Pfizer COVID vaccine. Just kind of holding off a little bit till we get that final word, obviously, to start, but in the throes of planning out dates and timeframes and how we're going to vaccinate those younger kiddos for COVID. So that is not official yet, but something we expect probably by the end of next week to go through.
Are all the clinics through right at the health department, or do you do anything with the schools then for children?
Our current clinics are right at the health department. However, in the past, we've gone into all of the middle schools and all of the high schools to provide the COVID vaccine, and we are talking about doing that again. We had done it, we're talking about doing that again in November, as well as offering, we're in the talks of choosing a date to offer for the 5 to 11-year-olds at, I believe we're thinking of Jefferson School, because they have a pretty good parking lot for people to go to. Some of the elementary schools in West Allis, West Milwaukee don't have great parking. But we are considering that too for kids to be vaccinated after the school day. I know I've talked about in the past how for the 12 plus population, we did pre-parental consent COVID vaccine. So we allowed parents to sign off beforehand, and then we vaccinated children at the school without their parents being present. Just given the lower age of these children, the 5 to 11-year-olds, we're not going to be doing pre-parental consent. We want parents to be there with those children because it's a little scary. And I think it's different for a teenager than a 5-year-old getting the vaccine for sure. So we're going to offer some after school, into early evening times for people to come get that vaccine with their child if they're interested. As well as, that's just us. There's a lot of vaccine providers in the community. So there's many places, pharmacies, local healthcare clinics that are providing a COVID vaccine as well, which is a great avenue for people who are looking for different hours and our availability for those vaccines.
Just to add to that, on that point, yeah, we're actually going to be meeting with Freighter Health System, Aurora, and Children's Hospital next week to get a line of sight on what we are doing or planning to do respectively in our own organizations with regard to the vaccine rollout for boosters and then potentially for the 5 to 11 as well. So all coming to the table.
Mhm. The booster shots, will they be given on site here?
Yes.
Not the other location where the,
Across the street.
yes,
No, we no longer have access to that
I
building.
see, okay. So if you need a booster, you come here.
Yep, and then tomorrow, just as a final update, tomorrow's our last public mass clinic for the flu vaccine. It will be at the senior center. However, you don't need to be a senior to access it. It's available for everyone. We're really just targeting that senior community. So we'll be over there tomorrow afternoon for our last big flu clinic. From this point on, we'll continue to offer the flu clinic 2 days a week. It'll just be done on site at this office and not such a grandiose scale. But we are hoping to get some good turnout there. I know a lot of seniors at that center I've talked to, and they're excited for us to go over to get their vaccine right on site.
Very good. Any questions?
Yes, Mark Roberts. One of the things in with the schools, with the new security measures that a lot of the schools have, I'm getting rumblings about people coming into the building. Not our staff, but people posing as parents or whatever. Have you run into that? And if so, have you been able to work around it?
We haven't run into any issues thus far. When we were vaccinating in the schools for that 12+ population, like I said, we did pre-parental consent, but parents were invited to come if they wanted to. And the school secretaries handled all of that for us. They did not say that there was any issues. There were a few parents that did show up for their kids' appointment during the school day to just be there with them. No problems. And then looking at the clinic that we will be doing at the elementary schools, like after school, we would be doing that in a general entry cafeteria with the rest of the building being locked off. So I don't anticipate any issues, but definitely with COVID, there's always some heightened concern about security and things we'll talk to the district about.
Yeah, and school cafeterias or gymnasiums are great places. So good. I just wanted to make sure that we were prepared for that should it come up.
Yep, definitely. Thank you.
Any further questions? Great, thank you. Now, Bob, did you have anything more to offer on this?
Nothing on communicable disease.
Okay, then we're on to legislative update.
That, yep. So you should be able to see in front of you just a sheet that I pulled off of our Wisconsin Public Health Association / Wisconsin Association of Local Health Department and Boards website, or WALDAP. Just a indication of what the current legislative priorities are for 21 and 22. This is more just in line in terms of this awareness raising information for you folks. But two, I just wanted to kind of point out that in terms of the legislative priorities, so if you just drop down a little bit further, you can see that at a statewide basis, West Dallas Health Department is in good shape with regard to addressing racism in the public health crisis. That is in alignment, with some direction and conversation we have had as a Board of Health. And then otherwise too, I just want to bring to the board's attention, if you look to the far left-hand side, preserving public health statutory authority, which, as I'm sure some of you are already well aware, has really been questioned in really the context of COVID. And, some of the current statutory rights that we have as health officers, as health departments to restrict, enforce, control, further outbreak of disease activity. And so there has been quite a bit of discussion throughout the state and nationally and worldwide with regard to our ability as a public health experts and with regard to the resources and tools we have, our ability to actually use those. So just be mindful of that. Certainly we don't want to put ourselves in a situation where as a public health department, we have our abilities to do what we need to do to control disease activity or otherwise, limited. So there has been quite a bit of discussion with legislators on this particular topic, and I suspect that it will continue, hopefully with success at the end. And then if you just drop down a little bit, just to kind of touch on some of the policy priorities, you can see that some of these are kind of tangential to what we do as a health department, but very much focused on what we call social determinants of health, so root causes of health. Some of these policy priorities are touching on those. And as a health department that has interaction with our own city housing department, certainly we're well positioned as a city to continue having those discussions with our colleagues over at City Hall. And so I just wanted to touch on that a little bit. And then certainly too, when we kind of talk about the importance of what we do and how we do it, kind of dropping to the bottom there, the ongoing importance of supporting best practices. And, part of that is it's not just in programs, we're not just about programs, but also, we have to pay attention to those policy opportunities that kind of present themselves for discussion with this, our particular body. And so I just wanted to elevate this and just bring this to your attention, but this is information that is available on the WPHA website. Two, I just want to put a plug in for board members. You have the ability to join as a member to WALDAB. And so that will essentially get you into a mix of other board members statewide, and potentially if we have interest in getting more involved in other statewide regional activities, this is a great platform to start doing that. So if you have any particular questions or interests, just let me know. I am a past president of WALDAB many years ago, and but I still have some friends up north who kind of manage this organization. And so again, if you are interested in becoming a member of WALDAB or just learning more about it, let me know.
Any questions for Bob? I know there's been a lot of publicity about mental health in the papers lately.
Yep.
But actually, we don't do anything of that nature, I don't think, ever
Right.
at the health department, do we?
No.
Resource referral.
Yeah, it's resources referral. We have, I would say, a growing partnership with the mobile integrated health folks who have access to staff as well. And so that's an avenue where we, continue to kind of test the waters a little bit and try and broaden that relationship and look at ways that, we can have more of a presence around. It's not just the health services, but the human services side of things. So, the importance of behavioral and mental health is something that, can't be ignored, but certainly, it's something that we strive to improve as not just the health department. But,
It seems to be more of a problem now
Yeah.
than it has ever been.
Well, it's pervasive. It really is. And so really, to Ashley's comment, we're really now in just a position of referring to resources that we know about, either in the city or in another jurisdiction or at the county.
Okay.
At this point.
All right. Okay. If there's no further questions, we'll go on to health department updates. We
Okay.
got good news to tell.
Yeah, I think so. Yeah,
Yeah.
it's all pretty enlightening stuff. We've got at least 2 of our vacancies filled, so great for that. We're ready to roll.
These ones.
What's that?
I said these ones. These
Yeah,
three people.
exactly. Yeah. And so we are still recruiting for a public health specialist. We did actually extend an offer to a candidate who took the weekend to think about it, and over the weekend wound up getting another gig. So she had to respectfully decline, but the position was reopened earlier this week. And that is set to close November 12th. And I suspect we'll have some good candidates coming in that we can interview. And but yeah, just kind of an unfortunate situation with regard to that initial round of interviews that we had. The other positions that we have, Senior Center Services Coordinator position, I believe interviews are scheduled
Just
to
about, yep.
happen, start next week. And then we have a Senior Center Janitor position that is still vacant. And hopefully we'll be able to fill that within the next couple of weeks. I think we've got one candidate in the pool at this point. So that's it as far as any recruitment activities that we have at this point. A quick update on the community health assessment process. So something that we've talked about a couple times in previous meetings. We are transitioning to have an online survey ready, hopefully within the first quarter of 2022. And so our public health specialist, Francis, is working to dot the i's, cross the t's on that survey tool, and we'll make it available online to the masses. So certainly we would hope that all of you as members of the Board of Health would respond to that directly. And so stay tuned though for more information on that. We will probably, well, we will in January-ish use that time to essentially have you take a look at the survey tool and offer any feedback that you might have. And then just to raise your awareness that this is forthcoming. So that's it on the CHA. Budget information, just a quick update on the current funds that we get from Department of Health Services, largely for lead and prevention and maternal child health and things like that. At this point, it appears that we are going to have pretty much level set budgeting in 2022. So those particular contracts essentially get negotiated between like now and the end of the calendar year. And so working to accomplish that. But I think we're in good shape going into 2022. So in addition then to the standard contracts that we get for some of the core programs and services we provide, of course, we are getting a fair amount of money from the state via the feds for ongoing COVID-related needs. So we have funding for vaccination efforts, for some testing efforts, for as well contact tracing efforts. And some of these actually are slated to go into 2024. And so we just know we've got some funding, but we need to use it wisely over the course of the next 2.5 years, depending on which pot of money we're talking about.
Bob, did you say that the COVID grants that we get from the federal government, that you work with the state to get that? Is that who's administering the fund?
They essentially are the distribution channel. So the federal government gives each state lots of money, and then Department of Health Services at the state level then pushes it out to those of us at the local level.
Okay.
There's not a whole lot of negotiation for that. They being the state largely use population-based formulas to determine how much money municipalities or counties get. Okay.
Any further questions for Bob?
And then the other last thing I have is, yep, if you want to pull that up, for those who are not aware, the city was awarded a gold designation through the Wisconsin, essentially the Population Health Institute. And so, working with our communications department at the city hall, they pushed out a press release to share this announcement. But it's a really good recognition to the city for its demonstrated efforts to support health improvement initiatives at the local level. So we had been previously a silver designee, and we have since, because of the strides that have been made here in the city, have been essentially promoted to a gold level. So if you drop down, you click on that link, allow that. This brings you to a little bit more background information of the organization that actually does the awarding. All right, and then if you go back up and hit, you're going to need to move that over a little bit. Sorry. You go to designees. I just want to show you kind of where we are in terms of our company. So you can see at the gold level, we're in pretty good company. And in Wisconsin, there's only 5 of us out of 18 who are at the gold level at this point.
I don't see the company thing that you're talking about. Who else has the gold designation?
All right.
Does anybody else see that?
Let you share.
There you
Okay.
go. Now I see it.
Okay.
Good deal.
Is there money attached to these designations or awards?
Unfortunately not.
No,
Just pride.
no, too bad.
Bragging rights.
Positive press.
I'm not seeing who awards this,
Wisconsin.
just the state?
Yeah, this is actually out of the University of Wisconsin Population Health Institute.
Okay,
Okay.
This is an academic body.
Is there a criteria for it?
There are criteria.
Okay.
Yep. And so this is actually based on an initiative and a program that the Robert Wood Johnson Foundation actually makes available to states. And so the criteria that is used is based on RWJ parameters.
So we're going in the right direction, and I'm so proud of our health department
So
that we finally reached the goal.
so it's again, we as a health department are a player in this, but certainly it's really important to recognize that in order to get to this level, it's really about demonstrating the partnerships that we have
Mhm.
with other departments, internally, but as well partners that we have externally, to include like the school district, the rec departments, and folks like that.
Great. Well, congratulations.
So we're all partners.
We're all partners, yes.
There you
The
go.
city can hang its hat on this. Yeah. All right, that's all I have for any updates that I have.
Oh, that's very good. That's good. I'm gonna wander back through the environmentalist here. If people have dead animals, what should they do?
That is a good question. And it kind of depends on the history of the animal and how it got to that point. If it got in a fight with another animal or with a person, or it bit somebody, we would want to potentially submit that to the state lab for testing for rabies. Okay, so if it bit somebody and then it ended up dead, we would want to submit the head of the animal to the state lab for rabies testing.
Oh,
If it's just a dead animal that they found, I'm still getting used to the way things are done in West Dallas, but my background is generally you're gonna double bag that, tie it off and throw it away in your regular trash.
Okay.
We would recommend, using gloves and a shovel,
Mhm.
not touching the animal and all of that. We don't recommend burying it, and I believe that might be prohibited as well, to bury it. And I don't think that the West Dallas, well, I know the health department does not collect those animals.
So we
Specifically.
could just throw it in the
And
garbage.
then if you want to talk a little bit though about blackbirds,
So the dead bird,
yeah, and potential for West Nile.
yeah, there is a dead bird reporting hotline. If you find a dead crow, raven, or blackbird, there's a phone number you can call at the state to report the dead bird. I think they discontinued where we would collect that and send that to the state. So that's no longer active either.
That's one way how the state tracks for West Nile and with particular breeds of birds are found dead.
Mhm.
And so I'm gonna assume that there's at least some cases of West Nile down here, but it's not like it is up north.
Right.
So really the only time we'd be involved is if the animal bit a person, and then ended up dying one way or another.
Anyway, yes, well, thank you for answering that. Basically, we get calls, alderman calls. My dog died, what should I do? Do you pick up? Do you pick up that animal? So I'm glad you clarified that.
They can always take it to the vet too and have it cremated or something if it was an animal that they are close to. They might be able to take it to the vet.
In here, Maddox
Mhm.
might be a good
Okay.
resource to call as well.
All right,
They did just get a
I'll
phone
get you
call.
on the side, yeah.
Yeah.
all right.
So for your bunny, you can just put that in the trash.
Well, I wanted our committee to be aware of, if they ever get questions regarding this particular subject, you might say.
Mhm.
So, any more questions from our committee? There's
no
way.
questions. No questions from me.
No questions for me.
No questions here.
Okay, very good. Well, now we have to have a discussion about our next meeting. As in the past, we have Thanksgiving on what would be the date that we would meet. So we generally pick a date in December for a meeting of both months, you might say, combined. So I have come up with a couple dates, and I thought I'd run it by you to see what you think would be the better date. We have the 2nd of December or the 9th of December. Do you have a preference at all of either one?
This is Grelke. I already have something going on the 2nd.
Okay. How about the
Mark,
rest of you?
Mark Roberts, I'm okay with either one.
I am
All
too.
right. Jane?
I'm okay with either one.
Okay.
Same,
Barb?
same here. Yeah, either one.
Okay, well, it sounds like we'll defer to Grandma Welke. Maybe have
Smarty.
the 9th, all of you agree on the 9th for a meeting?
Sure.
Sure.
That works. Sure.
Yeah, there will be Christmas cookies, right?
That will mail to you.
Sure, as long as you're baking them.
We'll have to mail them.
Yeah, why don't you come on down?
Yeah.
Join us
we
in
like
person.
that. We could have a party around the table.
No, you don't want me there. Come on.
Dr. Roberts. Oh, we're just glad to see you on board now.
I'm computer generated. I'm not real.
Oh, I'm so glad that all of you joined us, and hopefully you'll have a happy Thanksgiving, because we won't see you next month. But we'll see you in the month of December 9th. So I look
Well-
forward to seeing you all again.
I
Yours,
move to, we have to do it parliamentary wise. I move to adjourn.
Second,
There
Been
you go.
moved, seconded. Any further business to come before the board?
You.
In favor?
Aye.
I,
hi.
Opposed? Carried. Thank you all.
Thank you all.
Nice to meet you all.
Thank
good
you.
night, everyone.
Good night.
I-
Uh,
And then you can see us after.